The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everybody, this is Jonathan Marks from Go to Health Media. Welcome back. Thanks for being with us today. We bring you evidence-based medicine from health experts around the world. You can subscribe to our show at gotohealthmedia.com. That way you'll never miss an episode. And you can also watch us on YouTube and listen to us on 8 podcast networks. Today's show is called How Vaccines Safeguard Against Vulnerability. We're speaking with an immunization expert with more than 30 years' experience. But first, a little background. You've heard, of course, of the measles outbreak in West Texas that has now spread to New Mexico, California, Alaska, Georgia, Kentucky, New Jersey, New York, Rhode Island, and now Florida. Measles is one of the most infectious diseases known in medicine. We've experienced now 2 deaths, 1 child, 1 adult, and the virus has now sickened over 200 people. In addition to the notable skin rash, measles can also result in complications of diarrhea, vomiting and dehydration, ear infection, bronchitis, laryngitis or croup, pneumonia, encephalitis or brain swelling and permanent damage, and pregnancy problems including premature birth, low birth weight, and fetal death. The United States has a great tradition and track record of childhood vaccination, so much so that measles was declared eliminated from the United States in the year 2000 due to the high vaccination rates of 97%. In the past 25 years, however, vaccination rates have fallen dramatically due to misinformation about side effects and autism. We are now seeing increasing outbreaks of measles. We had 4 measles outbreaks in 2023, 16 outbreaks in 2024, and by February of 2025, just 2 months in, there have been 3 outbreaks. We're on track to have more outbreaks than 2023 and 2024 combined, given low vaccination rates. Measles outbreaks do not have to happen. They happen when we're not vaccinated. We will also discuss how vaccination programs work in our 50 states and the concern about future funding as CDC programs are cut. States have no resources to fund vaccination managers and vaccines without federal funding. I'll also ask our expert about flu preparedness for 2025, as flu is a recurring and deadly disease. With us to talk about all this today is Michelle Fiscus, MD, FAAP. She's the Chief Medical Officer of the Association of Immunization Managers, or AIM, and you can learn more about AIM at immunizationmanagers.org. She leads AIM's CDC-funded project to improve COVID-19 vaccination rates in children under 5 years and helps inform AIM's products, strategies, and policies. Dr. Fiscus is a board-certified pediatrician and former medical director of Tennessee's Vaccine Preventable Diseases and Immunization Program. Dr. Fiscus recently completed a 4-year term at the American Academy of Pediatrics Board of Directors and has served on work groups for the Advisory Committee on Immunization Practices. So welcome to the show, Michelle Fiscus. How are you today?
I'm doing great, Jonathan. Thank you for having me on.
Good. So I want to start this conversation with a question about evidence-based medicine, because everything we're going to talk about today about vaccinations is based on evidence. And so what I'd like to do is have you explain, Michelle, for the audience, what is evidence-based medicine? What does that mean?
I'm glad you're starting with that because I think a lot of people hear that term, evidence-based medicine, and don't necessarily know what it means. It sounds good, and it is good. Evidence-based medicine means that there is literature, there's published studies, there's well-constructed studies that have been reviewed by peers that can be replicated or repeated, and you expect when you repeat them that you're going to get the same results that other researchers have done. And so everything that we try to do in medicine should be and is evidence-based. So it's not that anyone's making it up on the fly. It's that there have been large-scale studies that can be replicated, that have been reviewed by other experts in the field to make sure that the recommendations that we make as physicians are consistent and that there is evidence to show that they're worth recommending, that they are done in a way where the benefit of maybe that recommendation is outweighing any risk that it might impose to the patient.
Thanks for that explanation. And that's going to be the basis for everything we talk about in this interview. So, the next place I want to go, Michelle, is back in the 1990s. There was a study that came out of England that showed that certain vaccines caused autism. And it was later shown that the data was not correct. The study was debunked. But for some reason, this rumor keeps being alive that somehow vaccines cause autism. What does the evidence say about that?
Well, the short answer is that evidence says they don't, but I'll give you a little longer explanation. So the study that you're referring to is one that was done by a British physician scientist named Andrew Wakefield, and it was published in a very reputable journal called The Lancet. And so, just being published in a journal like that gives you some credibility. I will correct that it didn't actually say that some vaccines cause autism. It suggested that there might be a link between the measles, mumps, and rubella vaccine
Mhm.
and the development of autism. But it was not based on great data or methodology. So this study literally looked at 12 children that were cherry-picked by the investigator to try to draw this connection between MMR vaccine and the development of autism. What was later found out was that the scientist, Wakefield, was on the payroll of another company that was making a competing vaccine to the existing MMR vaccine. And so he was conflicted, and we really want science to be unbiased and not conflicted. He was conflicted by being paid by that company. And the study was just incredibly poorly designed. You can't take 12 kids and then suggest that what you find in your study applies to the population at large. Unfortunately, it took 10 years for the Lancet to retract that study. And in that period of time, there was a spark that ignited really the start of the modern anti-vaccine movement. We've had anti-vaccine folks since the 1700s when the smallpox vaccine was first introduced in the late 1700s. But with the timing of this study and advent of the internet and social media and 24-hour news cycles, that information or misinformation in that study was able to get all over the place, especially in the 10 years that it was sitting out there before it was retracted.
Mhm.
And unfortunately, really want to make the best decision for their children, making a decision to not vaccinate them, which is not the best decision.
Let's talk about this measles outbreak, which has happened recently in West Texas, and it's now spread to 9 other states. And there's been death, and there's been a number of hospitalizations. It's the facts, the evidence shows that people who are unvaccinated there can be like a 20% hospitalization rate, and there can be a significant number of deaths. Measles, I know this is a long question. This is a long lead up to my question, but measles was basically eradicated in the United States in 2000, and it's been 25 years, and here we are now. I guess people have forgotten about what measles is really like and have not vaccinated their kids. We have the MMR vaccine, which is measles, mumps, and rubella, correct? Yeah.
Correct.
So tell us what's happening with the low vaccination rates and why the measles are coming back and what are the ramifications for this?
Yeah, I'm going to give you a long answer to your long question. So,
Good, please.
so measles is the most infectious organism that we know of. It is so infectious that if you went into a room where someone had measles and you were susceptible to measles because you had not been vaccinated or had not had measles infection as a child, then you have a 90% chance of acquiring measles, even if that individual left the room 2 hours ago.
Wow,
The
90%.
measles virus just stays suspended in the air. And so if you have an infectious person, you have to leave that area for at least 2 hours to allow those respiratory particles to settle down to the point where the next person isn't just going to inhale them. So it's highly, highly contagious. We think about Ebola and people are always, very, very concerned about Ebola, which they should be. But Ebola has nothing on the transmissibility of measles. There's a measure that we use called the R naught, which is if you have one person, how many people is that person going to infect on
Mm-hmm.
average?
Mm-hmm.
And so we think about, we've just come out of the SARS-CoV-2 COVID pandemic. SARS-CoV-2 R naught is about 2 to 3. So one person who's infectious with COVID might infect 2 or 3 other people on
Mm-hmm.
average. The R naught for measles is 12 to 18.
Wow.
So one person with measles will infect 12 to 18 susceptible people that they are in contact with. And just to put a point on that illustration, when I was working in public health in Tennessee, we had an individual who was unvaccinated, went to a country where measles was endemic, came back and was taking a road trip from Texas back to Tennessee when this individual became infectious with measles. And over the course of about 4 days, exposed 342 people from 15 states and 3 countries to
Wow.
measles. So it is incredibly infectious, and you can see how it only takes a plane ride or a car ride for those diseases to get all over the place. I once heard just a couple days ago that any disease in even the most remote areas of the world can be in the United States in 36 hours, which is a pretty sobering thought.
Wow.
So, yeah. So we have in the United States a great tradition of vaccinating kids. And so typically our vaccination rates across the country are very, very high. But because of the disinformation and misinformation that Wakefield and others helped to spark more than 20 years ago, there are pockets or communities that have very low vaccination rates. And you
Mm.
kind of think about how you might tend to live in an area where the people around you are kind of like you, think like you, act like you, look like you. And so there are communities where families gather together because they're with people who think and act and look like they do. And so in some of these communities, we might have vaccination rates in the 30 or 40% range. We need 95% of people to be vaccinated to stop measles from gaining a foothold back in the United States. And in those communities, that's not happening. And so, in this particular community in Texas, there was someone who traveled internationally and brought measles back to a susceptible community. And so the spark ignited there. And because diseases like measles don't recognize borders. You've had spread now into New Mexico. That there was a person who was announced that had died this morning in New Mexico,
Oh,
an adult.
the second one.
Um, the person in Texas was a 6-year-old child who'd not been vaccinated. That was the first pediatric death from measles that we've seen in over 20 years
Yeah,
because we vaccinate our kids.
right.
Um,
And we had eradicated measles in the United States, and
we had eliminated it. Yeah. So
yeah.
fine, fine distinction. So
Okay.
eradicate, the only disease that's ever been eradicated is smallpox.
Okay.
Eradicated means it is gone from the surface of the planet. And so
Got it.
smallpox was a very successful vaccination campaign. So much so, I was born in 1968 and I do not have a scar from a smallpox vaccine.
Mm-hmm.
Some folks that are my age do, but right around that time is when it was declared that we no longer had to vaccinate against smallpox. And so
Well,
for 56 years, we have not been vaccinating against smallpox.
got it.
But measles, we were still vaccinating our kids. It's required for school entry in all 50 states and the District of Columbia that you have an MMR vaccine, or two actually. But yeah, we had effectively eliminated it from the United States. We came very close to losing that elimination status last year because of outbreaks that were happening in Chicago and Pennsylvania and other places.
Mm.
We're over two-thirds of the case count already this year, this being the first week in March, than we had all of last year when we almost lost elimination status.
Yes, yeah, it's been really growing rapidly, hasn't it?
It has, it has. And I often post updates on social media about what those counts look like. And as measles does, those counts will go up exponentially because, one person infects more than one other person.
Right.
So we're going to continue to see those cases rise. Now we've got two things that work in our favor. One is we can give MMR vaccine even after someone's been exposed to measles. We've got about a 4-day window to get that vaccine in, and that should prevent them from developing measles, even if they've been exposed, which is
Hmm.
wonderful.
Yes.
The other is that spring and summer are coming, and measles is a winter virus. And so when you think back to the late 1980s when we had a huge outbreak of measles in this country, tens of thousands of cases of measles and almost 200 deaths, I think. What saved us from that outbreak was summer,
Hmm.
because we just don't see the virus circulate as much. So if you
Is
can
that
get people.
because, is it a winter disease because we're indoors and close contact, or is it really that the measles whatever it is it a virus, I guess?
It's a virus.
Yeah, so the measles virus dies during the summer. What makes it a winter thing?
Yeah, there's probably a lot of different explanations to that. One is that in the wintertime, because there's not a lot of humidity in the air and temperatures are colder, it makes it easier for respiratory viruses to stay in the air, and we're all clustered inside, hiding
Yes.
away. So that's why we see influenza and RSV, and we see spikes in COVID in the winter, and we see measles. There are probably other factors at work as well that play into all of that. But warm weather, will help us hopefully get out of some of this spread, but we've got to get people vaccinated.
So that's the major lesson here is get vaccinated. These vaccines are safe. They've been proven safe. All the childhood vaccines, they're just simply very, very, I mean, are there any bad reactions that people can get from childhood vaccines?
Well, like any medication, there are rare serious side effects. One, for example, is Guillain-Barré syndrome, which we sometimes see in adults who get influenza vaccine, and it's been tied to some other vaccines as well. It is very rare. And so if you have a history of something like Guillain-Barré, then there's certain vaccines that we would recommend that you not get.
Right.
There are certain vaccines that you shouldn't get if you're immunocompromised, if you're undergoing cancer chemotherapy or you're on an immunosuppressant drug for some kind of health condition, then you shouldn't get live virus vaccines like the measles, mumps, and rubella vaccine or the chickenpox vaccine. And so then it's even more important that people who are around you are protected from those diseases because you can't get vaccinated yourself. And that's where herd immunity or community immunity really comes into play, that
Hmm.
we want to make sure that there's enough people isolating and surrounding those people who can't get vaccinated that we can protect them from these diseases as well.
Got it. You mentioned before the flu or influenza and the flu vaccine. So I understand, and this is just in the recent news, that the Flu Vaccine Advisory Committee, they have an annual meeting. It's been canceled. We don't know if it's going to happen or when. What does the committee do, and what does it mean that it's been canceled?
So you're referring to the VRBPAC, which is the, if I get this right, the Vaccines and Biologic Products Advisory Committee. I think that's what it stands for.
Okay.
And this is a committee that meets 2 or 3 times a year, and they make recommendations to the FDA. And one of the very important recommendations that they make is what elements should go into the next season's flu vaccine. So that's
Hmm.
always done in February. Making flu vaccines is kind of a long process. A lot of the vaccines that are made for flu are made in eggs, which if you can think about eggs right now and our
Yeah.
issues with eggs having H5N1 bird flu circulating, they have to incubate the virus in eggs in order to make and then purify the virus to make the vaccine. And so there's a long ramp up time for that to make sure they have enough vaccine available by the time we start seeing flu, which generally that season is thought to start around October 1st. Um, so when the VRPAC didn't meet, that means that they're not looking at the data from the Southern Hemisphere that gets influenza in the summertime, or any of the data that we had on how flu vaccines worked for the season that we're in right now.
Mhm.
And so they're not there to select the strains and make those recommendations to the FDA. That is troublesome in and of itself, that we're not convening this committee of individuals who largely have spent their entire lives in vaccine research
Mhm.
and development. And this is a volunteer committee. They spend tons of time out of their days because they want to make the right recommendations to serve the public and to make sure that those vaccines are as close to being a match to what's circulating as they can be the next year. With VRPAC not meeting, the FDA has gone ahead and made public what strains they think should be put into the next flu vaccine. So,
Mhm.
fear not, we will have flu vaccines for the coming season. Manufacturers have already assured us that they are set, they are already working to get those products ready for next season.
Mhm.
But the precedent of not convening these groups of experts to help make decisions that advise the FDA and other bodies is really disturbing.
Yeah. Yeah. Agreed. Let's talk a little bit about your organization, the Association of Immunization Managers. What do you folks do?
We are a little known 501c nonprofit national organization. It is every day that I'm in conversation with people who say they've never heard of us, and, and
Hmm.
that's okay. But we work to support the managers of the 64 CDC funded immunization programs. So that's 50 states, the District of Columbia, 5 more major cities in the United States that are funded separately from their states by CDC. So that's San Antonio, Houston, New York City, Philadelphia, Chicago, and then DC is the sixth city.
Hmm.
And then several of the US territories and freely associated states. So Micronesia, Guam, American Samoa, and others. And so there's 64 altogether when you add up the cities, the states, and the territories.
Hmm.
And we work to help make their jobs easier. They have, I think, one of the hardest jobs in public health. And I used to serve in that role when I was in Tennessee before I came to where I am now. Those immunization program managers are responsible for making sure the Vaccines for Children program functions in their state. That is a federal vaccine program that provides vaccines at no cost to families who otherwise might not be able to afford to get them. So that's
Hmm.
all the children on Medicaid, which is almost 50% of
Yes.
children in the United States, Alaska Native and American Indian children, children who are uninsured,
Hmm.
or children who are underinsured, which means maybe they have a health policy that was grandfathered and doesn't have to meet the requirements of the ACA, and isn't paying for vaccines. So it's a huge program, billions and billions of dollars in vaccines every year that are used to make sure that that cost is never a barrier to getting children vaccinated.
Hmm.
Um, in addition to that, they have to run their state's immunization information system, or their IIS. That's the registry that is basically your online vaccination record, so that you
Hmm.
don't have to worry about having a little card or a baby book with you. They run that. They also work to end outbreaks of vaccine preventable diseases. So our members that are in Texas and New Mexico and New Jersey and all the other states that currently have outbreaks are working very closely with others in public health and emergency preparedness to try to make sure that they identify people who are infectious, get them quarantined so that they don't infect other people. And in the cases that we can provide MMR vaccine if they've been exposed, or if they can't get MMR vaccine, so they're immunologically suppressed, they're pregnant, or they're babies under the age of 6 months, then they're getting immunoglobulin, which is pooled antibodies that we give them to help them not get measles.
Got it. So you mentioned there are 64 of these folks in 64 different locations around the country and outside the US. And you also mentioned that they're CDC funded, and that immediately sends up a flare for me because we are cutting back funding at the CDC. What would happen if the CDC funding to these state managers was dried up and not existent anymore? Can the states afford to pay these people and continue these programs? What would happen?
That's what keeps me up at night. So the states are actually in the process of writing for their next 5-year grant for CDC to fund right now. So their current funding ends June 30th of this
Hmm.
year. They, most of the states in the United States and territories are funded 100% by the CDC. So if that funding were to be eliminated or drastically reduced, they would not be able to administer the Vaccines for Children program in their particular jurisdiction. So vaccines would be available, but there wouldn't be any way for the providers who give those vaccines to order those vaccines, which they
Mm.
do for their state or their jurisdiction. And then the jurisdiction pulls them down from the national resource. They would be hamstrung to be able to respond to emergencies like measles outbreaks. They would not be able to continue their immunization information system or their vaccine registry. So the data that goes into those registries might stop being reported and maybe couldn't be evaluated or used to understand who might be at risk when there's an outbreak or to understand what coverage rates look like in their jurisdiction. And most states would have a hard time. I mean, they might be able to help fund the staff that are there with the program. It's unlikely that they would be able to afford the vaccines that
Mm.
would be coming in for the vaccine from the Vaccines for Children program, which, would cover on average about half of the kids in their state. I don't think any state would be able to afford to vaccinate 100% of the children in their state. So then we could see immunization rates plummet as well.
Wow. And so these vaccines are really provided by the federal government to the states or the locales. And the federal government is the one paying for this.
Right. For the Vaccines for Children program, that's an entitlement program that was created in 1994. And for 30 years, the federal government has put out the funds to purchase those vaccines. And that's protected by legislation. They
Mhm.
can't mess with the budget without going in and actually doing something to undo the program. But they could fund the vaccines, but then not have a vehicle to actually get the vaccines into the arms of the kids that need them.
Got it. So we should be as citizens, I mean, this is tremendous risk if this goes through. We as citizens should be talking to our representatives about continuing the funding for these programs.
Yeah, funding, from the federal government is really critical to that infrastructure.
Mhm.
And I think it's important that people understand that the situation, that they're vulnerable right now with the cuts that are happening. So it is something that I worry about, and that I think the immunization programs certainly worry about. They don't have a windfall of funding. I mean, there was lots of money that came in through the COVID pandemic from the federal government, and they can still use some of that funding, although it is set to go away. But the day-to-day operations of those programs really need to be supported by the the money that's given by the federal government.
Got it. Good. Really want to thank you for being with us today and sharing this very, very important information about vaccines and funding. Michelle, what kind of message would you like to leave with us?
Well, thank you for having me. I think these conversations are so important. For parents and grandparents who might be questioning whether or not they should vaccinate their children, as you have said, these vaccines have been in use for decades. In the case of the MMR vaccine, since the 1960s. And we've forgotten what these diseases look like. I've
Yeah.
only seen measles one time in my 30-year career as a pediatrician. I haven't seen chickenpox in probably more than a decade. I've never seen mumps. There's a reason why we got rid of these diseases, but in some ways, vaccines are the victim of their own success, and that people don't know how horrible these diseases are. The one thing I would say is that if your child or your grandchild were to develop a serious illness of some kind, you are very likely to take that child to their pediatrician or your children's hospital for them to be treated, and in some cases, for the people who work there to save that child's life. These are the same people that are reminding you how important it is to vaccinate your children and your grandchildren according to the recommendations that are put out by the CDC and adopted by the American Academy of Pediatrics. You will not find a single children's hospital in the United States that would tell you not to vaccinate them. And they're the same people who are going to be called upon in some situations to provide the life-saving support that that child might need if they were to come into contact with a disease like measles or some other vaccine preventable disease. So please listen to the scientists and the people who are there who have dedicated their lives to taking care of children and adults to try to make their lives healthier and free of the suffering that these diseases can cause.
Thank you. Michelle mentioned the CDC guidelines for vaccinations. I will include a link to those guidelines on our website at gotohealthmedia.com so that you can go to that website and learn or relearn what the vaccination schedule should be for children. Michelle, I want to thank you so much for being with us today. It's been such helpful information to spread to our public and our audience. We've been talking with Michelle Fiscus, MD. She's the Chief Medical Officer of the Association of Immunization Managers, and you can learn more about them at immunizationmanagers.org. Thanks so much for being with us today, Michelle.
Thanks, Jonathan. I enjoyed it.
Good. And remember, everybody, you can watch us on YouTube. You can come to our website at gotohealthmedia.com and subscribe so you don't miss a show. And you can also listen to us on 8 podcast networks. We'll see you again next time. And remember, as we say at the end of every show, go to health. Take care. God bless. We'll see you next time. Bye. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.